Hi everyone, welcome to our YouTube channel Odontology, the study of teeth. Today we are going to see about the maxillary nerve in detail. Before going into detail, please subscribe our channel Odontology, the study of teeth for our upcoming videos. Okay, so let's see maxillary nerve in detail. Maxillary nerve is a second division of trigeminal nerve, which is a fifth cranial nerve. The trigeminal nerve is a fifth cranial nerve. It has 3 branches. Among that, the second branch is your maxillary nerve. So, this is your maxillary nerve. Okay. This maxillary nerve is a purely sensory nerve. In last classes and all, we have seen that mandibular nerve, right? That mandibular nerve is a mixed nerve. That is, it has both sensory activity and motor activity. But here it is only a sensory nerve. That is, it has only the sensory activity. So, what is meant by sensory activity? If the signal is carried from the sensory organ to the brain, see, the signals are going from the sensory organs to the brain. The nerve fibers which carries all the signals from the sensory organ to the nerve, that is your sensory, that is happens through your sensory nerve fibers, that is your sensory nerve. Okay, so it has only the sensory activity, there is no motor activity for the maxillary nerve. Okay, let's see the course and relation of the maxillary nerve in detail, how it goes, how it distributes, and what are the structures it supplies, and all we will see in detail. Okay, so before going into detail, you should know some of the structures I have drawn here to understand the course and relation of the maxillary nerve. Okay, let's see. The first one is your this is your foramen rotundum. Okay, this is your foramen rotundum. From there, from this foramen only, the maxillary nerve is coming out of the middle cranial fossa, and so this red one is your inferior orbital fissure. Okay, inferior orbital fissure, and the last, this is your inferior orbital foramen. The red one I have drawn that all are foramen only. To indicate the foramen only, I have drawn a circle in a red color. Okay, so this is your trigeminal ganglion. So from the trigeminal ganglion only the maxillary nerve is arising, right? So this is your trigeminal ganglia. This is your second branch. Okay, first branch, second branch, and the last one, the downward, which is pointing downwards, is your third branch. So this maxillary nerve arises from the trigeminal ganglion and pierces the trigeminal cave of dura to reach the lower part of the lateral wall of cavernous sinus. This is your middle cranial fossa. This happens within your middle cranial fossa. Okay, so it reaches and it leaves the middle cranial fossa through foramen rotundum. Okay, so the foramen rotundum, with the help of the foramen rotundum, it leaves the middle cranial fossa and reaches the pterygopalatine fossa region. Okay, so from here to here, once it left from the foramen rotundum till it reaches the infraorbital fossa, the pterygopalatine region located. Okay, so this is your pterygopalatine region. From there it will give some of the branches. After that it will enters and runs straight through the inferior orbital fissure to reach the orbit. Okay, so it will run forward along the floor of the orbit in the infraorbital groove and canal and reaches the face through infraorbital foramen. This is so see, through the foramen it is coming out, right? So these are the course of the maxillary nerve. Okay, so let's see the branches. What are all the branches the maxillary artery it's giving through the transverse area? Okay, while it is transversing through the different region, how it gives us it branches, and what are the structures it supplies. Okay, in detail. So it gives branches from 4 regions as it passes along through the 4 different regions. Okay, the first region is your middle cranial fossa. Within the middle cranial fossa itself it is giving your first branch. See, this is your middle cranial fossa, and the second branch, the second area where it gives all the branches is your pterygopalatine region, and the third area is your in orbit. It is also, I have written here, the space between the inferior orbital fissure and the infraorbital foramen is where the canal, inferior orbital canal lies. So in third one is your, in the orbit, how it gives. Okay, the fourth one is your face. On the face, what are the branches the maxillary nerve is giving. Okay, if in first middle cranial fossa you have only one branch, that is your meningeal branch. This is your meningeal branch. Meningeal branch is nothing but it supplies the dura mater of the middle cranial fossa. Okay, so it runs upwards and supplies the dura mater of the middle cranial fossa. Okay, so here is your meningeal branch. These two branches are your meningeal branch. Within the second pterygopalatine fossa, you have three branches. The first branch is your ganglionic branch. Second branch is your zygomatic branch, and third one is your PSA. This is your first branch, that is the ganglionic branch. It has two in numbers. You have two branches of ganglionic branches which supplies the pterygopalatine ganglion. This is your pterygopalatine ganglion. So okay, this is your first branch of the within the pterygopalatine area. The second branch is your, as I said earlier, zygomatic nerve, zygomatic branch. It enters the orbit through the inferior orbital fissure and reaches the lateral wall, and it gives two branches. Okay, inferior orbital fissure, and it gives two branches. I have drawn here clearly. Okay, these, what are the two branches that is given from the zygomatic nerve is here zygomatico-temporal and zygomatico-facial. This one is your zygomatico-temporal branch, and this is your zygomatico-facial branch. As the name indicates, the zygomatico-temporal branch will supplies the skin of the zygomatic region and temporal region or temple region. Okay, zygomatico-facial means the it supplies the zygomatic region and the facial region. Okay, so here I have written clearly zygomatic region and temporal region. As the name itself it shows, you can remember like that. Okay, the next branch is your PSA, that is posterior superior alveolar nerve. This posterior superior alveolar nerve will reaches the face through the one or two few foramens, small foramens in the posterior aspect of the maxilla, and supplies the mucosa of maxillary as sinuses, and it supplies the maxillary posterior, molar teeth. Okay, see, so that's why I have written small terminal branches in the PSA. Okay, this is how it supplies the supplies within the pterygopalatine region. And in the third region, in orbital region, you have two branches, that is MSA and ASA. MSA is middle superior alveolar nerve and ASA is anterior superior alveolar nerve. Let's see the MSA first. Okay, the MSA is middle superior alveolar nerve, right? This middle superior alveolar nerve runs downwards and reaches the lateral surface of maxillary sinuses, and it supplies the premolar teeth. So let's see, this is your MSA, that is middle superior alveolar nerve. As I said earlier, it reaches downwards and reaches the lateral surface of the maxillary sinuses, and it supplies the premolar. The next one is your ASA. Okay, so this is your ASA, anterior superior alveolar nerve. It will also run downwards and reaches on the anterior wall. It divided into two branches, that is dental and nasal branches. The dental branches will supply the incisors and canines. Okay, and the nasal branches will supply the floor of the nasal cavity and lateral wall of the inferior meatus. So you have two branches, right? So I have written the two branches. The nasal branch will supply the floor of the nasal floor of the nasal cavity and lateral wall of the inferior meatus. And let's see what are the branches on the face. Okay, you have three branches as I drawn here. Before that, let's see, assume like this. So first branch, second branch, and your third branch. Okay, here you will have your eyes. So I am schematically drawing the structure. Okay, here you have eyes, right? So I have drawn a simple circle. Here you have your nose and your upper lip region, right? So like that you remember. Okay, the first branch is your palpebral branch, which supplies which runs upwards and supplies the skin and lower eyelid. Okay, this is your palpebral branch. So remain like that. The first one goes to your eye region. Okay. The second one is your nasal branch, which is supply the side of the nose, I mean the skin of the side of the nose and the mobile part of the nasal septum. This is your nasal septum, which is the mobile part of the nasal septum. Okay. So the third branch is your superior labial branch. As the name itself it shows, it supplies the superior region of the labial. Okay. So it supplies the skin and mucous membrane of the upper lip. Okay. These are the three branches of three branches that is arising on the facial region. Okay. So let's brush up once again. Maxillary nerve. Maxillary nerve is a second division of trigeminal nerve, which is a fifth cranial nerve. It is purely sensory. Sensory is nothing but I have described here, I have shown here. Let's see the cause and relation. It arises from the trigeminal ganglion, pierces the trigeminal cave of dura to reach the lower part of the lateral aspect of cavernous sinus and leaves the middle cranial fossa through foramen rotundum. From there, the foramen rotundum, it reaches the pterygopalatine fossa by running forward. From the pterygopalatine fossa, it enters the runs straight and enters the orbital through along the floor of the orbit in the infraorbital groove and canal and reaches the face through infraorbital foramen. The area between the infraorbital fissure and the infraorbital canal, foramen is your infraorbital canal, and branch in face it gives three branches. The maxillary nerve will gives different branches the way it transfers through. It has four regions, that is first one is within the middle cranial fossa, second one is the pterygopalatine fossa region, and third one is in the orbit, fourth one is your on the face. Okay. So in the middle cranial fossa it gives only one branch, that is middle meningeal branch, which runs upwards and supplies the dura mater of the middle cranial fossa. This is your meningeal branch. Okay. So in the pterygopalatine region it has three branches, that is ganglionic branches. The ganglionic branches has two in numbers and supplies the pterygopalatine ganglion. The second branch is your zygomatic branch, which runs upwards and enters the orbit through inferior orbital fissure and gives two branches, that is zygomatico-temporal and zygomatico-facial region. Zygomatico-temporal will supplies the zygomatic and temporal region, and the zygomatico-facial region will nerve will supplies the zygomatic and facial regions. The third one is your posterior superior alveolar nerve. It reaches the face through one or two foramens in the posterior aspect of the maxilla, and it supplies the mucosa of the maxillary sinuses, and it supplies the maxillary molar teeth. Okay. So in the third region in the orbit you have two branches, that is MSA and ASA, middle superior alveolar nerve. This middle superior alveolar nerve run downwards on the lateral surface of the maxillary air sinuses and supplies the premolar. ASA also same thing, runs downwards but on the anterior wall and divides two branches, dental and nasal branches, which supplies dental branches which supplies incisors and canine, and nasal branches will supplies the floor of the nasal cavity and the lateral wall of inferior meatus. Fourth is your on the face, it has three branches, palpebral, nasal and superior labial. Palpebral branches will run upwards and supplies the skin and lower eyelid. Second branch is your nasal. Nasal supplies the side and side of this, supplies the skin of the side of the nose and the mobile part of the nasal septum. And the third one is your superior labial, which supplies the skin and mucous membrane of the upper lip. So I have written here, it is not clear, but if you listen to the lecture you will understand what are the branches I have written here. Okay. So this is how the maxillary nerve originates and supplies all the regions, and how it transfers, what is the exact origination and relation of this maxillary nerve we have all learnt in this video. Please subscribe. Hope you like the video. Thanks for watching.